I would state using Regen right away is it's incredibly safe. That's what I want people to really understand is there's no real risk to doing stem cells in your joint, in your any part of your body, on your face, in your veins. It's just, will you see the effects that you want? And I think that's going to come from more research, understanding what the therapeutic load should look like, how many stem cells, and what kind of stem cells. And that's where we need to start tailoring the protocols.
Welcome to the Functional Code, your go-to source for decoding optimal health. Join Dr. Addy and Dr. Jace as they break down the science behind pain, performance, longevity, and more, making complex concepts easy for you to understand and apply in your life. Your journey to a healthier you begins with understanding the Functional Code.
Welcome back, everybody, to the Functional Code, episode 30. Today, we have the Regen series, part brain, and we are going to dive into everything with the brain today, involving the ways Regen Med can help improve some of these conditions. We're going to talk research on some of the ways that they're using stem cells to improve these conditions. And lastly, we're going to be talking about theories to how stem cells can actually improve the brain and these certain conditions. So buckle up. We're glad to have you. As always, I am Dr. Addy.
And I'm Dr. Jace. Yeah, we're very excited to bring to you some interesting different conditions that you may have or you may know someone who has. And Dr. Addy said this Regen Med is something that is coming to the forefront. More research is going into this field, which is going to change the way and how we treat some of these conditions, especially based on the effects with less risks. It just opens things up for a whole different ballgame with less symptoms that we're not usually used to. So in terms of today, I love how Dr. Addy framed this in terms of the whole podcast itself, much the same as we touch on each condition, then we break down where the typical ways to manage it as of right now is, and then where the stem cells and these other regenerative medicine therapies, how can they influence each one? So in terms of today, we're going to be talking about the treatment management for traumatic brain injuries, and even go into 5 potential ways that stem cells can help aid with that. Also, we're going to be talking about COVID-19. Now, oftentimes when you hear COVID-19, you think of, oh, it's that 2020 disease that people they didn't have enough research on, and there's a whole political side that we're not going to get into. But we're going to break that down, and there's some fascinating, awesome results with some of this regenerative medicine that is going to shock you. So pay attention to that. Coming up, the top causes of Parkinson's disease and even some therapies for regenerative medicine that can aid with that. And then we're going to finish off with stroke and the treatment for patients that have undergone strokes. So, Doc, when we hear traumatic brain injury, oftentimes people think of concussions. They think of, oh, I either lost memory or I just got jostled. Maybe it was a sporting incident. Maybe it was a car accident.
Yep.
I know there's different classifications and severities depending on how much the brain got injured. But as we dive into this brain series, I love how you framed it and starting off with traumatic brain injuries or TBIs. But let's dive in. What's your broad term definition of traumatic brain injury, and let's dive into some of the statistics and how it can affect the body.
Absolutely. So with TBI, it can range from mild to severe. It just depends on the classification of that. TBIs typically happen from a very jolting blunt force trauma to the head, and that can range from a car accident, like you said. It can range from a football player getting tackled. There are a lot of ways that patients can have a TBI happen to them. Most of the time, it could be mild concussion or it could range on to severe head injury. It just depends on how awful the incident was. But when you classify TBI, there's a general breakdown of mild, moderate, and severe. Mild is a loss of consciousness for less than 30 minutes. Moderate is anywhere from 30 minutes to 24 hours with usually more significant cognitive impairments. And then severe is longer than 24 hours with profound, not only cognitive, but physical and even emotional impairments. And when you look at severe TBI, the mortality rate is around 30% if you've sustained a severe TBI. Now, the survival rates have improved, obviously, with advances in medical care, but even disability now, there are, I think, around 5 million U.S. Americans who are dealing with the effects of a long-term TBI. And it's only going to get more and more. And a lot of people don't realize that TBI is actually a leading cause of death worldwide.
Wow.
So there are a lot of things that can come with TBIs. And the problem is once a certain amount of time has been reached in between the incident and around 90 days, if we haven't been able to get over the hump of getting these symptoms under control, there's research that shows those symptoms might actually either be long-term or permanent. And so the real goal is to make as much neuroplastic change in 90 days as possible. And if not, then we might have worsening circumstances moving forward. The ways that most patients have effect from a TBI, again, like we talked about, it can be cognitive, anything from memory or attention issues, processing speed. I've had patients where they take a very long time to even answer your question, and it's not that they didn't hear you, it's just to process it and then think of something to move. And these could be anywhere from 18-year-olds to 70-year-olds. It really changes the speed of how things are processed for them. Emotional changes, behavioral changes, they'll have aggression, mood swings, depression, anxiety. I know I've had patients who said that they are angry for no reason. They'll just have a harder time regulating their emotions. Sensory changes where vision, hearing, even sensitivity to light. There are times where I've had patients who had injuries while they were driving, and now driving for them is very difficult, and
Wow.
they have this connection, past trauma to that. Physical symptoms could be motor dysfunction or weakness, coordination problems, tremors. Again, that's just if there was more than likely cerebellar change, then we'll notice ataxia and just inability to have good coordination, proper wall structures and gait. And that's something that you'll definitely want to break down. People don't realize that roughly 90% of your brain's energy and output is done just to keep you on 2 feet. So 90% of all of the work being done in your brain is just to help you balance.
It's incredible.
And so when you don't have that, it's very exhausting because your brain is working so hard, and now it has to work even harder. And you don't have much energy left because it's already putting so much electrical output into that foundation.
Which is then why when some therapies for just even like eye tracking that can be so draining.
For sure. And it can be within 20 seconds draining for them.
Wow.
I've had doctors that I've been studying under that mention it's so taxing for some of these patients that they will get a seizure doing it. And so I know I've had a good doctor, friend of mine, that really knows how to manage these conditions. He's a chiropractic functional neurologist, and he had gone into seeing these patients, and one of the patients was a younger male, I believe. And he come up to we were in a clinical rounds group, and he had said, this patient we're about to see is going to have a seizure today. Like, it's going to happen. He
just prefaced that.
He understood these
my
conditions so well. And so he did the optokinetic tape, which is this tape that's mixture of red and white lines, and it's helpful to break down eye movement, get patients to do certain treatments with it. And no or less than about 20 minutes into it, the patient had a seizure. And to have that kind of confidence and understand these conditions that well enough to push them in a direction of positivity, but also know that there might be some flare-ups or drawbacks to the condition. It's incredible to hear some of these practitioners and how they treat these patients.
With just even that case scenario, because obviously he had the confidence to say that, you have to push the patient to have the seizure. Was there positive outcomes and benefits from the therapy?
Yes.
Even though it induced
So
a seizure.
at the, I believe, 6-month mark, the patient was not having seizures anymore.
Wow.
And very rarely, if any. And again, I think it was just through neuroplastic change, desensitizing whatever pathways were involved. Among other things, the patient was doing a lot more than just that too in office, and at home.
Fascinating.
But just understanding to affect these very difficult conditions to treat. And these are very difficult conditions, and a lot of people don't see the results that they were looking for because now they're stuck with these long-term symptoms. And these patients are fathers who need to work from home, and now they can't stare at their screen for longer than 30 minutes without getting a headache and have to take a break. These patients are 18-year-olds who now went from straight A students to not being able to look at their homework for longer than 20 minutes without not being able to process, function. They're athletes who used to be at the top of their game, and now they can barely remember a certain play or playbook in their playbook. It really does affect them in such a way that makes them lose confidence, and now they don't know who they are anymore. And I had a gentleman who had what was called vagal nerve dysfunction from this, and he couldn't exercise because the second that the heart rate elevated to a certain extent, the vagal nerve dysfunction would kick in, and he would literally, he said that it was like his body was trying to shut down.
Wow.
And so even just trying to be better and work out and work on yourself, he was shut with such resistance. And he had multiple concussions, unfortunately. But it gets to a point where it's called sequelae, which is just long-term symptomology now. And trying to affect patients who have had this for so long, where to start, how to get any change without provoking even worse change, really is a challenge. And that's where I think providers who really specialize and have a background in functional neurology make such a difference. These individuals, if you've never heard of any of these providers, I would suggest you look into them. Gentleman, Dr. Schmo, we've talked about him before in Minnesota. We're both from that area. He's got a lot of great before and afters of what he's done on certain patients. Dr. Carrick, you can go on Carrick Institute, look up what he's been doing. I'm sure there's many more now in probably every state that you can go and look at. But
these are individuals world renowned.
Yes.
This is not just, oh, this is a good doctor. They are, but yeah,
Phenomenal.
go to the top.
Phenomenal. And if you are struggling to find the changes in either yourself or someone you love, I would start with that first. Not only with the treatment portion of things, but maybe even the diagnosis part. You might be getting results, but sometimes it's just best to know what's going on too. And that's where you got to take a look at everything from eye tracking, from balance, from even extra imaging if needed. They really do know how to break everything down. But yeah, regardless, most patients, when they receive either a mild or severe TBI, I would say mild most of the time makes a full recovery. Severe, again, after 90 days. If those have not been addressed and or even looked at, it's harder for you to regain full recovery if you haven't been making an effort into making any change or helping that area.
Absolutely. And I know that some of the people that we've seen too, with even past car accidents, especially acute ones, or even ones that they've had years back, but they're like, it's fine, I got over some symptoms, but they might not realize that the changes from before changed, whether that's the mental load, whether it's memory, whether it's like what we said, emotional state, and that's changed their whole life. Some people recognize, some people maybe not as much.
Yeah.
And going back to the mild, moderate, severe, obviously the moderate, severe can leave lasting change long-term unless addressed, whether that's tissues, because a lot of times if there's any damage to any joint, whether it's whiplash symptoms, that can force instability in certain areas of the spine, not even in addition to the whipping and concussions of pretty much bruising of the brain for the most part. But usually when that happens with the tissues that we've seen, it leaves what's known as like neurological tightness, where the whole muscle belly is contracted and guarded. And the only way you can get that under control is contractions to the tissues at length to have the body recognize the connection to the brain, and then you can restabilize over time from there. But that can last decades long. It can lead to compensations, which then can break down other parts of the body too. So just food for thought. Yes, you want to start off with more like the mental, cognitive, the processing. Going back to the functional neurologists, I think that would be the first part that I would start off with. But then you also want to make sure the other residual symptoms from pretty much body down or brain down will have another huge effect on the whole system. So, Doc, what have you seen outcomes for mild, moderate, and even severe? Because I know you brought up, was it 30% of, what was it?
Yeah, the
Mortality
statistics
rate
showed
for
that
severe?
severe TBI mortality rate is approximately 30%.
That's incredible.
And when we talk
Mhm.
severe TBI, this is the worst of the worst when it comes to a head injury. I wouldn't say that most of the patients who bump their head or have, very rarely does severe TBI happen. So
Okay.
it needs to be a awful car accident where you were in a coma and lost consciousness for many days, like that kind of thing. So
Wow.
those are the kinds of rates of mortality on this kind of head injury.
Okay.
But with the long-term effects of mild and moderate TBI is usually where we were seeing patients in that state. Severe TBI, gosh, I don't think we even saw one patient who had something classified as a severe TBI. And most of the time, those patients are doing from the start physical therapy at bedside and really just trying to regain any and all function of life to get started. So it's maybe a different step for them. But as far as mild and moderate, absolutely. And it does continue to make your life so much more difficult when you don't get these symptoms under control. And as far as outcomes go, really, as long as the sooner you start, definitely the better chance of you making a greater impact. Usually just as a fresher injury, it's already healing. You can make a bigger impact neuroplastic wise. At longer term, again, it's a little harder, but not to say that you can't make those changes. But with most of the patients who come into clinics where they're doing functional neurology, I would say well over 50%, even probably higher, see some change. And a lot of them can regain most of the cognitive efforts and loss of symptoms that they had just from balance work, eye movement tracking. A lot of other clinics have what are called gyrospheres, where they're in these large circular sphere-shaped mechanisms that rotate certain ways very fast, and they're like a spaceship. And it's really helpful to invoke certain vestibular and neurological pathways. And what's so great about them is talk about this story of Sidney Crosby, where we had talked about in the past. He had multiple concussions and really didn't have any other avenue to go down. And so when he went to see Dr. Carrick, that was one of the first things that Carrick did with him, was put a gyrosphere, I think, or gyroscope. I can't remember what it was called, but it is, I think just after day one of doing that, I think he said, subjectively said his symptoms improved by 50% just by doing that alone. And again, it's just crazy how just that neurological reset can be so effective at helping patients who have gone through these kinds of things. And to not know that's out there for you if you have issues is frustrating, but it is. There are ways to make really strong changes to these unfortunate symptoms that you get from this issue.
And I actually got a chance to go in one of those and go through a whole session, and you go, there's different targets that they have. You shoot like a laser as it moves you around, so it can shift, I think, the focus of your eyes at different angles, if we will. But do you know, is there a set way that it can spin, or is there a bunch of variations?
Yeah, you can absolutely. It's as technical as you can imagine. When you look at the canal systems in your head and you talk about how that can now correlate with your movement patterns and balance systems, you have six segments. You have frontal left, frontal right, you have horizontal each way, and you have posterior right, posterior
Oh,
left.
sure. Okay.
And so when you move the eyes through certain patterns, you are tracking it in that certain way. So it's using the tracking system. You definitely want to make familiar with what's called the H pattern, obviously, with when we do eye movements. But it's being able to know, is it frontal left, posterior right, frontal right, posterior left? Was it horizontal? And then a breakdown can really help give you, okay, do we need to move them in that pattern now because of that breakdown? And that's really where it's very generalized, but that's typically one of the easiest ways to, I guess, to explain it.
That's incredible.
Yeah.
Okay, so obviously there's other therapies that people may not recognize, and I'm just even learning some of this myself. And I wouldn't have had any idea without shadowing a bunch of different clinics. But okay, for traumatic brain injuries, now people may think stem cells.
Yeah.
Most people, even myself, would never think those two would ever intermingle. But I see there's potential research coming out that show otherwise. So what have you found in terms of theories on how stem cells can impact traumatic brain injury?
Right. And there are a lot of ways that they are applying stem cells to these patients, some of them surgically.
Oh, wow.
Other ways would be intravenously. Some of the times I think they're doing intranasally. A lot of the ways that they can impact the brain can be done intranasally, which is starting to be a more common mechanism of application. But with stem cells, if these patients do have direct impact to the spinal cord, the spinal column, not obviously with the brain involved as well, that's usually where these patients are getting epidurals or application direct onto the cord, and they're seeing these crazy changes. And I think it's only going to get better as we continue to research it, but we still need to understand what can we and what can't we affect or help. But one of the main reasons why stem cells are so helpful is because they're known as paracrine signalers, and so they can signal the appropriate cells to make changes when needed. And not only can you make changes appropriate to whatever tissue you need change with, a lot of the cells that already are making an impact have the ability to create stem cells from them. So for example, when you have something regarding a neuron or a brain cell, there are specific stem cells that focus on brain health and regarding that issue, or at least secreted growth factors from those cells. And so when you can take and create stem cells from these cells, that's where you can get maybe more of a change. Such as if we were having issues with bone and we'd take a bone marrow stem cell versus having issues with brain, taking a cell from the brain and creating a stem cell from that. So a lot of the times when we look at the reasons to why stem cells maybe help TBI or any other brain issues, you're going to look at the kinds of factors that they can secrete, such as BDNF, VGEGF, and TGF-beta. And these, again, just to create a neuroprotective environment, they can help reduce apoptosis, which is just cell death that's going on after the injury. And of course, they can encourage new blood vessel growth if there is damaged brain tissue. And that's just the first theory that they are trying to understand more about when implanting these stem cells into patients' bodies.
Fascinating. So it's almost, obviously we've touched in the past with stem cells having a systemic effect, but to have the effect on the areas that can help build up the body instead of keep sending resources for, or having the damaged areas continue to replicate, thus the long-term chronic use will get worse from there, obviously. It's probably the better layman's ways I can say it, but thinking back from the past stuff that we've talked about, it makes sense to actually think about how well certain receptors, certain chemicals will be impacted just by the stem cells getting back to the body is remarkable. Okay, so now we need to know that it can affect other like paracrine functions. Does it also have an effect on reducing the inflammation as well? And is it on similar receptors than we previously stated in other podcasts?
Yeah, so with the abilities of stem cells, one of them is the ability to modulate the immune system. And that's another thought process to how stem cells can impact any and all conditions, including ones in the brain. So being able to modulate the immune system, especially if there's chronic inflammation associated, those are the other thought processes to why they maybe can decrease secondary damage from the initial injury, and then moving forward, create an anti-inflammatory state if there already is a lot of inflammation present. Other thoughts of how it's possibly helping is it has homing mechanisms built in, so stem cells have the ability to get to areas of damage. That's just one thing that has been studied in research. It, again, promotes angiogenesis, which is the formation of new blood vessels if they have been damaged. They can affect the blood-brain barrier, again, if that's an issue, usually with a head injury. Stem cells secrete exosomes, which exosomes are small enough to pass the blood-brain barrier, which is another topic of should I use exosomes instead of stem cells when it comes to treating patients. And then just the reduction of oxidative stress or excitotoxicity from injuries. So this is just due to reactive oxygen species that form, again, from chronic inflammation, from injury, those kinds of things. And stem cells have been shown to reduce those to, again, create a much more healthier environment, especially in the brain. Of all the ways that we have theories of how this is going to help, we still need to figure out the main reasons to why they're working so well with these patients, because when we start to break down that research and try to understand one versus the other, the problem is going to be understanding not only the positive, but is there going to be any side effects, or is there going to be any alterations in tissue? We still need to make sure we understand that. But the beautiful thing about the research being done is it's showing to be incredibly safe. And that's where we'll obviously get into that in a little bit here. But that's where I think I'm at the point now where I've seen this enough that if I were to ever have an issue, and I have had head injuries before, and I've done this intravenously, my fear is almost zero. I have none. I think it's one of the least risky ways to impact yourself if you've had anything like this. And as long as you are working with a provider who knows what they're doing, I really see no real reason that you can't go and try this without seeing some kind of change.
That's incredible. And I like how you broke down each and every one, that there would be potential effects based on what stem cells have shown in the past. And I know you brought up exosomes and how there's very little research with just exosomes itself.
Right.
But just the fact that they can cross the blood-brain barrier for the healing effects, systemic and potentially local, which would make sense from there. Okay, so I guess what research do we know thus far about stem cells and traumatic brain injuries, and what do the studies look like?
Right. And throughout the podcast, we're going to obviously be taking apart more and more conditions. But just to preface, of the research presented today, it's definitely a research that has been done on a smaller sample of patients. So we still need higher quality, higher cohort studies being done. But the studies themselves were done very well, in my opinion. And I think moving forward, when we'll start to see more and more of these done, we're going to be seeing the same effects. Unfortunately, we always got to wait 10 years before everything is up to date on research and things like that. But I've already seen enough with the research that has been done. But this first study was 40 patients with TBI sequelae. So this is just long-term symptoms after TBI. And they were given a lumbar puncture via insertion of the stem cells. There were groups that were broken apart into placebo and the groups that were receiving the stem cells. And the stem cell group showed results in what was called the FMA and FIM, which is assessment tools to help measure basically cognitive movement, communication, just all the other types of things that we would attribute to motor function, cognitive function. And very clearly, after 6 months, the stem cell group had significant improvements in both FIM and FMA results, including upper and lower motor extremity motor function, sensation, and balance improvements. They also showed the ability to improve self-care, sphincter control, mobility, locomotion, communication, and social cognition compared to the control group.
So many different aspects of brain
Right.
and body. Wow.
So it was hitting obviously several areas of the brain and just the clinical significance of that. We're talking now the ability to take and insert, unfortunately, lumbar puncture, that's going to be more invasive, but just to very quickly create that kind of change just from a insertion of stem cells, really not too much effort for the patient. Unfortunately, the lumbar puncture again is invasive, but when you take a look at really the effort involved just to make those kinds of changes, I don't see why we aren't doing this on more patients.
Even going back to I think it was last podcast or 2 podcasts ago, and that's one small case study that an individual just dumped stem cells on the spinal cord after they were paralyzed. And after, I don't know how long, their body started working again. It's almost very similar to the lumbar puncture and how it just got injected
kind of put into that
the
area.
system.
Right.
Yeah, so a similar effect. So there's almost like 2 case studies on how it can help regenerate not only the nerves and just even the chemical reactions based off of the nervous system's function is incredible. That's 2 ways now that we know that it can possibly help in a very severe way.
Yeah, and if you actually look, there are more studies that have been done on TBI. It's just making sure that you understand studies being done are smaller. We don't have a lot of really large studies that have shown the effects of stem cells on these patients. But right now, what that study did help show was the patients saw results and there were very little side effects, if any. So this is incredibly safe to try. And I would even start out with intravenous instead of a lumbar puncture, just because, again, creating the least invasive as possible. And we would do this on patients intravenously, and we would see really great results with certain patient conditions. I know concussion was something that saw results quite quickly, and also patients who had any type of just long-term cognitive change, really brain fog, clarity issues, focus, those kinds of symptoms. And you'd be surprised at just how little amount of injections were needed to really start seeing change. So it's easy for one man to sit up here and state just what I've seen in practice over time, but I think I'm going to argue that as this research comes out, we're going to see more and more of this being used. And I hope it's going to be used and it's going to have to be done in a way where they're going to need to make a lot of money off of it, unfortunately. I don't know how they're going to do that using a human cell tissue product, but eventually they'll create a way that they're more comfortable, obviously doing it to the masses. But there still are plenty of providers out there who are willing to do this with their patients, and bless them, because it's definitely needed for the kinds of issues that people are dealing with right now.
That's incredible. Okay, so now that we know traumatic brain injuries, stem cells can help. We've seen it multiple times. Obviously, like you said, we need more research for larger studies, maybe long-term as well. But okay, so let's dive into a different topic, something that can affect the whole system, but have different influences on different areas. If you guys are following, I'm talking about COVID-19. So back in 2020, there hasn't been much research, and the research that has been done, especially from certain physicians nationwide and broadcasted, weren't necessarily the best. Efficacy is probably the best way you could say it. But now looking and doing more research on even regenerative medicine side of things, we're seeing incredible results. So Doc, COVID-19, what does that breakdown look like? And then how can regenerative medicine help with that?
Yeah. So the way that the SARS-CoV-2 virus kind of affects the brain, first and foremost, the direct way would be entering the brain via the olfactory bulb, which is why if we breathe it in, it can affect that area so quickly. So when we have effect of the olfactory bulb, we can lose changes in smell and taste, which is what is very commonly affected when we have COVID. But it also can disrupt the blood-brain barrier, or it could even infect the blood vessels in the brain. So what we start to see is this systemic inflammatory response that can contribute to neuroinflammation and brain tissue damage. But they also are starting to show more cerebral vascular events when you have COVID, if you have underlying morbidities. And this likely is due to what they state as hypercoagulability and endothelial dysfunction. Now, we're still trying to figure out, if we'll ever figure out, the changes in patients having strokes and infarcts from not only the COVID virus, but the vaccine as well. And if we get kicked off of YouTube because I said that, I guess we'll get kicked off of YouTube today. But they now have come out and showed certain companies definitely did create more heart issues with the vaccine. Now, whether that was just inflating the COVID's virus's symptomology on the patient or whether that was the vaccine alone, there's so much more that they're probably not going to tell us. But what we do know is that was something that happened, and it was not just coincidental. And then lastly, the involvement of COVID-19 regarding respiratory function, it can lead to hypoxia. A lot of patients would have O2 stats in the 70s when they had COVID, 80. And this was, unfortunately, you're wanting to shoot to that 90 or 95, 99 area when it comes to your O2 stats. So anything below 90, you should definitely be looking closely at, even going into getting it taken care of at a hospital. But yeah, I had patients telling me that they woke up and we had checked their stats and it was like 80 or 70. And I'm like, you need to get to the ER right away. And they just didn't understand what that meant. But yeah, it absolutely can just murder your lungs. And those are actually the kind of studies, some of the studies that they had done was trying to get over this acute respiratory distress that COVID would put on these patients. So yeah, again, how it affects the body, not only does it have acute, neural symptoms, but it can definitely have what's called long COVID, long-term symptoms. Patients that we saw with long COVID always had sleep issues. I would say over 80% had changes in sleep.
Saw that too. Yeah.
And so those were a lot of the patients that we were seeing. They couldn't sleep and we were trying to get them to sleep better. But brain fog, memory issues. We had a gentleman who came in who just wanted to smell and taste again, and it had been 2 years. He lost his smell and taste for over 2 years, COVID.
Wow, fascinating.
I can't imagine what that's like. I lost mine for a month. I thought I was going to die. Perspective.
Yeah.
So this gentleman, we told him too, it said, with no chance we can guarantee that this is going to make any change, but we can take apart what we think is possibly going on and try to make any secondary supportive effects to the body to see if there's going to be any change at all. And unfortunately, I don't think we were able to do that with him. But with a lot of the patients who had brain fog, clarity issues, sleep issues, tremendous effects using not only functional neuro technology, stuff like that, but with Regen.
And I really respect that you bring that up to the patient and say, yeah, there may or may not be positive effects. And I think that's something that most physicians, especially, they think obviously from a business side of things, oh, yes, we can help anything and everything. But from this COVID-19 perspective is, I think, very admirable, and I think gives more comfort to patients as well, but having them understand that there is going to be some risks, some information that we still don't yet know because it is very early on.
For sure. Yeah. And what I would state using Regen right away is it's incredibly safe. That's what I want people to really understand is there's no real risk to doing stem cells in your joint, in any part of your body, on your face, in your veins. It's just, will you see the effects that you want? And I think that's going to come from more research, understanding what the therapeutic load should look like, how many stem cells, and what kind of stem cells. And that's where we need to start tailoring the protocols. But the real chance of anything severe happening, less than 1, if any, 0. I'm going to say nothing, never say never, but in the 5 years I've been doing this, I never had what I would consider even a major side effect. Simple side effects were just irritation at the site of injection and some lightheadedness, which I think came from them just being a little nervous from the treatment.
Or even from them not eating prior to, or
Who knows?
drinking. Like
Right.
there's some
Who
small
knows?
things that could have those effects.
Other than that, yeah, we did not see anything.
That's incredible.
So for those interested, I definitely would look more into it
Mhm.
and find someone who's done it for a while, who knows what they're doing, who knows what they're talking about. But yeah, back to COVID.
Mhm.
Management right now has been across the board. They tried to make medications. Vaccines didn't really, in my opinion, do a very good job. It was shot out quickly, and now we're seeing unfortunate effects from that. And you had issues with the lungs, you've had issues with the brain, you've had issues with the body. They're trying to then chase what's going on from the virus itself. So you're mitigating the secondary effects of it via, if it's lung, your large amounts of prednisone and corticosteroids. You're looking at nebulized treatments, them trying to figure that out. As far as the brain goes, there really isn't much they did to touch that. That was more of just, unfortunately, you're going to have to deal with this kind of a conversation. Joint pain, NSAIDs, and other types of painkillers. But I know, Doc, you had found that, was it exercise made it change with a lot of patients too, though?
Yeah, so dove into a couple lines of research, some of which from back when it was starting to happen, but most of it was a couple years afterwards. They started seeing effects for individuals, more younger individuals
Okay.
that exercised regularly during them having COVID, showed reduced in symptoms, but this is more for mild symptoms like the severe ones, especially if you have respiratory issues, lung function. You want to manage it to the best you can, because obviously the lungs, if that starts going downhill, then getting oxygen into the system is going to be very difficult.
Sure.
And then it can lead to other problems from there. So you'd want to have exercise regularly based on your tolerance level.
Yeah.
But the study that I found was more in younger women, which I'm glad they actually zoned in on females. But for the younger folk is different than some of the older individuals. And I think that's where there wasn't much research that I found exercise-wise for the older individuals, but just knowing that it can help for symptoms if your system is working properly, I think will have a good result for your system. So
I wish more had the ability to exercise during
Mhm.
COVID. The gyms were shut down. They did a real number on the mental health of patients and physical health. Not being able to go to the gym during a time where I think that should have been crucial. That should have been essential.
Absolutely.
It was sad. It was sad to see. It killed a lot of people.
Mhm.
And it's a harsh statement, but at the same time, I really think there were way more important other ways that I could have managed it moving forward. But anyway, so yeah, the research that I brought forward today regarding that, I think I brought forward two studies, but the first was done on patients who had what was called ARDS, or acute respiratory distress syndrome. And that's where you have this just storm of inflammation that happens in the lung area, and they're getting such difficulties with breathing, and they almost develop close to a breakdown, and the management of that comes with needing to possibly put them on a ventilator. It really can be quite a fatal path if it's not managed properly. And so that's where they really were looking into anything for this issue. And obviously stem cells was one of them, because my guess is they were shooting darts at a board trying to get something to stick to help with these patients. So the reason why this is some of the very little you'll find phase 2 trials with stem cells, maybe phase 3, but this was a phase 1/2A trial, double-blind, randomized, controlled, 24 subjects. Half was a stem cell treatment group. The other half was the control. This was an intravenous infusion of stem cells administered on the day that they had issues and day 3. So there was 2 infusions. So they also assessed how safe this was, and if, again, they looked at survival rates, time to recover. These patients were quite ill. So this is what they were showing. But what they found, first and foremost, no serious adverse events related to the infusion of stem cells. There was no difference in infusion-associated adverse events between stem cells and control group. And they deemed that these infusions were absolutely safe, incredibly safe. So this was a great study, not only for what is about to come as far as the effects, but just how safe that this is for patients. As far as the survival rate of patients, let's just start with that. Improved significantly. Stem cell group, 91% survived compared to the control group of 42%.
I mean, sorry, very unfortunate, but oh my God, that's a huge.
Just
huge,
that alone should be the end of the study. But they also looked at time to recover, which was significantly shorter in the stem cell group compared to the control group. They found significant decreases in inflammatory cytokines using blood markers. So again, very efficient in not only keeping them alive, managing their inflammation, and the safety involved in this study really, I think, catapulted Regen Med forward when it comes to treating really harsh issues like this.
Even when, because I know this study was in 2024, but even with some of these studies that they come out with, just even look at the survivor rate, I feel they have larger studies because you need patients that have a similar environment, similar framework, so they can test out, does this help, does this not help?
Sure.
The fact that they got 24 is awesome, but also at the same time, as certain COVID symptoms in a general population are diminishing compared to years previous, I think it's also harder to find subjects for some of these studies as well.
Exactly.
And just for them to be okay with it. So even with some of these smaller trials that we've seen, I think we definitely need to take more from it than just, oh, it's less subjects. There's parameters that we all have to deal with, but just the fact that we're seeing the results, we definitely can't dismiss it. So I thank you for bringing that one to the forefront.
And the next study is even better because it has 464 participants.
Even better. There we go.
But again, this was on just patients with COVID, not the ARDS subset of symptoms. But what they were measuring was mortality rate, improvement rate, C-reactive protein levels, which is an inflammatory marker, the days to hospital discharge, and of course, adverse effects. So it was a systematic review, meta-analysis of all randomized controlled trials up to April 30th, 2022 for participants. As far as mortality rate, had a significantly lower mortality rate, which they expressed as 34% reduction in mortality rate compared to placebo. As far as symptom improvement, there was clinically symptom improvement time was significantly shorter, which was around 4 days quicker to the control. CRP levels significantly reduced in stem cell group compared to placebo. Stem cell group had a shorter hospital stay, roughly three or 4 less days in the hospital. And again, no significant difference in the adverse events between stem cells and the control groups. Again, showing just how safe and well tolerated this procedure is.
Damn.
So when I got COVID, this was the first thing I did.
No shit.
Yeah.
That's so smart.
Yes. And I'm a healthy individual, so it's tough to say whether I would have gotten better or not, but I was what I would call improved and or back to normal within 24 hours.
That's incredible.
And I didn't lose my taste and smell. Now,
you did.
I did not.
Did not. Okay,
the second time I got COVID, I didn't do this. I didn't have the means to. I was in a clinic that we weren't doing it at the time.
Okay.
I lost my taste and smell for a month, and I didn't get better until I think a week and a half in.
Wow.
I don't know what that entails, but I do know I really wish I would have done it.
Which makes sense.
And if I ever get to a point of illness or I need, that's the first thing I'm going to do.
When you look at even hospital rate, like 4 days, that's thousands of dollars, which theoretically, like stem cells are not cheap. So that's one, but that would make up the cost there, but then some as well. Insurance covers are not either or, because then you have less symptoms, less time sick, better for your whole health and status. That's incredible.
Yeah.
Okay. So why has this not become standardized, and what other things do we need, in your opinion, do we need to make this standardized for specifically COVID-19?
I don't know if we're going to see a standardization. It's crazy because in Europe, a lot of this stuff is standard. Like ozone therapy is in almost every hospital in Europe. They do laser over there. They do a lot of the alternative things. Right now, I think Japan is leading a lot of this in Regen Med, even PRP.
Oh, wow.
And what's crazy in Japan is a lot of it's dental.
Really?
Yeah. Most of what they're doing is dental, which is
I would never
so
thought
cool
that.
because I think that is a space that truly does need a push in a more alternative, preventative kind of effort. And I just don't think the technology has changed so much over the years. But yeah, as far as what's next, you can't patent a human tissue product. You can patent the process, you can't patent the cell.
Yeah.
So the devices and technology that can maybe create some of these things, yes, but the actual individual product itself, you'll never be able to 100% reproduce every time, because if it's coming from either a donated source or yourself, everyone's going to be different. So there's no real way to standardize that. And there's no real way to get an FDA approval of that. So you're going to always have somewhat of an issue setting up standards and protocols for that. But what you'll hopefully see is more and more providers and researchers paving the way to create guidelines and standards of how to create the safest and most efficient product and term. And then that is then taken and accepted as safe, efficient, helpful. But where we're going to, start with that, I don't know. But we might get to a point where we can have more and more cell banks of these products. And those banks then are actually regulated intensely. And not to say that they're not right now. They are. They have to be. It's not just some guy's basement where they're keeping all of these products. The FDA knows where each of these banks are, and they're in communication with them every day. These labs are visited by the FDA. Yeah, because you don't have any existence or connection with the FDA doesn't mean that they still don't regulate a lot of these things. So even supplement companies, there's no approval FDA-wise by them, but many people who have worked either for the FDA or in other committees are working with these supplement companies now. They're trying to create as healthy and high standardized, good manufacturing processes as possible. So the problem comes from acceptance across providers and healthcare companies, but really it's the money that they're going to be making using this versus other protocols. Putting them on a ventilator was, I think each patient you put on a ventilator gave you, I think, $36,000.
Jeez.
I think that's what it was. It was a lot. So, of course, they were incentivized to do such.
Of course.
A stem cell intravenous infusion can be anywhere from a couple thousand to a little more than that. So you're losing $30K a patient.
God, that business man thing. And that's like when you brought that up too, going back to the banks, like I originally thought of like, we just need more places to where they can store blood. And even then it has to be a very cold temperature.
Yep.
And for years on end, so you have to have backup generators and whatnot with that too.
And the providers have to then, of course, have those kinds of facilities to store that. And we used a liquid nitrogen tank to store the stem cells. And then we had a very cold freezer to store other products if we didn't need to store them in that cold. But again, it's not difficult to do. It's just understanding how to do it. But yeah, I think we can get it done. I think more and more studies are going to be done. It's just a matter of those the powers that be, whether they'll actually let this happen or not. At any time, they have the ability to create some kinks in the chain if they really wanted to. And they have. They've done a good job of weeding out a lot of the old stem cell companies that aren't a thing anymore because they were cutting corners and not being appropriate in their manufacturing processes. So the ones that are still left standing were the ones that knew how to very efficiently and safely create these products. So again, we're going to continue to see these changes over time, and eventually I think we're going to get us a much more superior product. But then comes the new wave of tissue engineering, which is, like we talked about, that's being done not in the United States, outside of the United States, where they're manipulating these cells, creating superhuman cell tissues, and starting to make changes with, we've talked about cancer and Parkinson and all these other things. And that's where bringing that back in the United States, I don't know if they'll be able to do that. If
like our government.
it'd be nice. It'd be nice if they could, but yeah,
Man.
more on that maybe in 5 years.
I'm so excited there. Now, when I heard Parkinson's and stem cells, I never thought as well those two
Right.
would even mix.
And to be honest, I would say Parkinson's is one that we have a long ways to go. But
Okay.
a lot of the reasons that I think they choose to do regen with a lot of these conditions is because the state of patients' symptomology is so severe that they're really just trying to find anything to help with these patients. Now, before you hear what I'm about to say, and you have patients or you have it yourself or someone, there are a lot of mainstream things being done on Parkinson's right now and regarding medication and surgical implants. So those are well more studied, have way more research behind them, and can make some incredible results. So I would definitely hone in on that first. Now, if you still find that you're having issues and just not getting the results you want, then maybe look for a regenerative medicine provider. But first and foremost, make sure you're working with a neurologist that knows what they're doing. We had a provider, I don't know if you ever met him at Northwestern, who had a deep brain stimulation implant, and he was able to continue with his career. He was a teacher, and he still is able to lecture and communicate. And I think he's in his 60s or his 70s. I don't remember what his last name was, but he said that it was the only way that kept his quality of life alive was with the DBS implant.
Fascinating.
And so I remember, because I took his class, it was complex cases, and he literally broke down the most complex cases that he's seen, including Parkinson's. And that was one of the things he recommended that patients look into if they have really severe effects. Yeah, he still had you could tell he walked with a gait issue. He had the masked faces. He didn't have the greatest coordination, but he was very independent compared to most who have the disease at a later end stage. And communication was tougher for him, but he lectured us. He was lecturer, independent of himself. He had no help there.
That's incredible.
So
I feel like if I see his face, I'd know who you're talking about there.
I'd have to look him up.
Either or. No, that's incredible.
So that's where I would obviously dive in first, looking at these kinds of issues. But promising things coming up with Regen and Parkinson's, and I'm excited to see what happens.
Okay, so Doc, with Parkinson's, and if you guys want to know more information, like you can always YouTube the more specifics on what Parkinson's disease is, some of the classifications. We're going to dive into more of the specifics of how regenerative medicine can potentially help for individuals with Parkinson's. But much like what Dr. Addy said, like the newer research in this area and newer trials outside of regenerative medicine, like he said, is very promising. So obviously, if something is not working, by all means. But Doc, what's the study that you've come up with? Because I know I'm briefly looking over it. It looks incredible.
It was a promising study. It only was done on 7 patients, unfortunately, but these patients averaged about 15 years of having Parkinson's, and they were followed up to about 36 months. And what they were able to show was using what was called the UPDRS scale, which just helps to track symptomology of Parkinson's. They showed a 14% improvement across the board for patients, anywhere from improvements in facial expressions, gait, which just means your ability to walk, reduction in freezing episodes, so just rigidity. A lot of Parkinson's patients have rigidity issues. And 2 patients were able to reduce their Parkinson's medication. No serious adverse events reported, indicating that obviously transplantation is super safe. And obviously it showed as the symptoms and motor function improved, we still have a lot more to look at. But with all the studies that I've read regarding intravenous infusion, stem cell injection in joints, we still have yet to have one documented case of death.
Wow.
Ever. Among other things. But where I think most patients should find it in themselves is if they've exhausted enough efforts and this is something that they're interested in, there should not be any barrier of fear, but there should be a barrier of expertise and talent. And so you want to make sure you are looking at these providers and they've been doing this Maybe they even have a specialty in this. Hopefully they have somewhat of a neurology title by them, chiropractic neurologist. Even there are MDs and specialties that do these kinds of procedures too. That's just what I would preface first before you jump into this. Not to say that there aren't amazing providers out there without those titles, but it takes a certain amount of effort to understand these conditions and diseases, and you've had to have seen them for many years to really know how to help them, or at least interned and been a part of that sphere and really understand it, because I wouldn't want anyone to exhaust finances on this without knowing that they're going to get at least some change. And the way that they're going to get that done is those who've done it before and are good at doing it. So that's how I would preface that.
And even having what you said too, the provider must have ideally expertise, knowledge, like you said too. But, you know, if you have the financial means to potentially use this, as long as it's a walk through these other individuals, these physicians, I think could potentially help so many other things. And even enrolling into certain studies, depending on what you have got going on, I think it always benefits everyone as well too.
Definitely the going premise, which is if you do this, you're going to see some change, some results, whether or not it's mild or extravagant results. But, you know, I think most who undergo these injections do see some results in most of the studies that I've read.
Even with some individuals, there's even studies they're doing for Parkinson's out of Colombia, to where if you have Parkinson's for longer periods of time, that they're doing these studies on individuals, check genetics, but then there's other influences for like age, other components involved in terms of exercise, any other conditions involved as well with some of these individuals. Also add into it, because with Parkinson's, it's just not one size fits all for treatment. Okay, so Doc, so I know we touched on Parkinson's, traumatic brain injury, now and a few others, but stroke, because I guess how does strokes, and especially in terms of lack of blood flow to certain parts of the brain, which can cause it to die off and lead to a bunch of other symptoms systemic wide. I know we looked at stem cells and how it can have a systemic effect and the potential therapeutic effects that it can have just on the chemical processes and sequences. But what are some of the specifics that you found for individuals for strokes?
I think this is the most promising when it comes to certain brain conditions. They've done the most amount of research on it, and the research has been very well done. We'll get to that in a little bit, but when it comes to stroke, there are several ways that it can happen. Most common is what we call an ischemic stroke, which is just loss of blood flow due to a blockage, and that accounts for about 87% of them. There are some other ways of getting stroke, whether that is vessel rupture, and that can cause stroke. And then there are what we would call a mini stroke, which is a TIA, transient ischemic attack, which is just temporary disruption, not actual permanent disruption of blood flow. Typically resolves within 24 hours. But those that are most prone, high blood pressure is a leading risk. Atherosclerosis, if you have AFib, if you have diabetes, if you're a smoker, obviously age is always going to be up there. Gender, lifestyle factors, we can obviously take all of those into play too. But usually what you'll find with these patients is there'll be what's called hemiplegia or hemiparesis, weakness or paralysis on one side of the body. So it's usually, if it's done left side of the brain has the stroke, the right side of the body is going to be hemiparalyzed. Now you'll also have issues with communication and speaking. That's called aphasia. You're going to have issues with dysarthria is another word where you're having slowed or slurred speech. There's sensory deficits, visual disturbances. You might have dysphagia, which is difficult swallowing. A lot of issues. Most likely you're going to see them difficulty walking, balance, and coordination is a very common one too. But with what we're seeing right now, what type of stroke matters on how they're going to improve, how quickly they intervened, super important. Because again, I think it really does have this 90-day window kind of effect that we talked about even with TBI. Rehab is going to, right away, you're going to want to try to rebuild those neurological pathways, physical therapy, even eye movements and other kinds of functional neurology treatments. Super helpful. I would recommend doing it. And again, if you have other conditions like heart disease, diabetes, that's going to reduce your impact of recovery, I guess is a way to put it. But right now, there's a lot coming out on how to effectively manage stroke, but there are still advances that we need to have in order to get patients who ultimately have long-term effects moving forward. And some of those, unfortunately, are permanent, but we're trying to figure out what of them aren't and what can we actually make an impact on. And if they are, how can we even enhance or improve them? Not take them away fully or remiss, but with the main symptoms that we definitely can make an impact on, I think, is movement. So balance and coordination and gait all can be really well impacted. Even understanding clarity, mental focus, those kinds of things too can absolutely be changed. But where I think you're going to see coming up, obviously, with the research, the symptoms that, I guess the onset was, they intervened very quickly. So that was a benefit. And the kind of symptomology change was quite substantial. And I really am glad that we're seeing at least some of the conditions make an effect with stem cells. And they're actually taking this and doing really a lot of research on. So this was a multi-center RCT, and 280 patients with acute ischemic stroke within 24 hours of onset were enrolled.
Wow.
So
that's a big study.
This was done with intravenous stem cell therapy or placebo. Patients were followed up 12 months later, and they used the Rankin scale score at 6 months, and then secondary endpoints was the National Institute of Health Stroke Scale, just to help with quality of life assessments. So the stem cell group showed a significant improvement compared to placebo at 6 months using the Rankin scale. And I'll get to what that looks like as far as what that meant. But the NIHSS scores and some neuroimaging markers of brain recovery were also improved at that time. So the safety, again, well tolerated, no differences in incidences of serious adverse events between stem cell and placebo. And the therapy was associated with a lower incident of post-stroke infections and other complications. So yeah, using those two scales, it showed a huge improvement in the quality of life and functional improvements in these patients, stem cell versus placebo. Which again, larger sample sizes are going to be needed, better follow-up, but it was a great starting point. And the Lancet was actually the journal that took on this and published this study. So
very prestigious.
Lancet, yeah, prestigious journal. It was great to have it that to as far as move forward, as far as research. The second one I included was, this is 150 patients with chronic ischemic stroke symptoms. And the average duration was 6 months to 5 years post-stroke. So this is, again, more chronic. But what they found was, again, they used the Rankin scale and the NIHSS scores to show change. Stem cell therapy was well tolerated, no differences in serious adverse events. What they showed was there was a huge improvement in Rankin scores and NIHSS scores. They even showed brain perfusion scores improved as far as better blood flow in the brain post-treatment. And again, super safe, very helpful for these patients. And these are just two of, if you were to go on, there's, I would say, in the tens, maybe hundreds of studies on stroke. So what we definitely have is way more research and just comfortability of doing these treatments on patients. But
even from looking at the studies, from one study that it was administered within 24 hours, the other one anywhere from 6 months to 5 years.
And still saw results.
Yeah, that's regardless whenever it gets administered. To a certain extent, we probably still need more research on that, depending on person's variance, but it'll have a positive effect, safety-wise, have a positive effect on all these other conditions. Even like this last one that you said that for the diffusion and processing the mental brain function is incredible. Just opens up for the possibilities. of all areas for stem cells, for systemic wide, local. It opens out from there.
What I know is if I or someone who I loved ended up getting a TBI, stroke, something, concussion, where it's some type of brain issue or brain interference, I'm going to fly and do a stem cell and intravenous injection on them as soon as I can.
That's so smart.
I already have that set up if anything like that were to happen to someone that I love.
That's beautiful.
That's how confident I am, knowing that it's going to make a change in their life and continue to do it. Might even do it monthly for them. Might even be weekly to get started.
Sure.
That's where a lot of these protocols need to be built so we know what's the most effective. But I'm confident enough to say that's what will be done with those who I love, because I am that confident it's going to make that great of a change in their quality of life if they unfortunately end up getting anything like this.
Yeah. You see it from the research, multiple episodes of the podcast. We see it from your past experience with patients too. And when you said 0 adverse reactions from what we know thus far, it's why not?
Yeah.
Like, it only has potential upside, significance with that. So I like that.
Yeah.
Thank God I know you too. No, that's perfect.
Yeah.
So, Doc, thank you for bringing all areas of the brain and how regenerative medicine, especially stem cells, can impact various other areas, whether it's looking at implementing it straight to the nervous system, to the tissues, which will have effect on the whole system. Brain function is incredible. Is there any other closing remarks you want to leave the viewers with today?
No, I appreciate you guys for listening. This was definitely maybe more educational, a lot of information. If you guys want more of a broken down or even more layman's episode, we can maybe try to come up with some other information for you guys. Just let us know. But hopefully this was helpful for everybody. And if there are any of you guys have questions or are curious or even have questions on recommendations of providers, just let me know. I definitely want to make sure I can point you guys in the right direction. And just as always, thank you guys for listening so much.
Absolutely.
Until next time. See you guys later.
Disclaimer, the content provided in this health podcast is for informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast. If you think you may have a medical emergency, call your doctor or 911 immediately. Reliance on any information provided in this podcast is solely at your own risk. The creators and hosts of this podcast are not responsible for any actions or decisions you may take based on the information presented.
Thanks for joining us on The Functional Code. For more evidence-based health insights, subscribe, rate and review wherever you get your podcasts. Remember, your journey to a healthier you begins with understanding the Functional Code. Until next time, stay well, stay informed, and embrace the science of living well.